Hey folks, Falcha. You are going to be getting some more vlog style content because I definitely want to be posting more on my YouTube over the coming weeks and maybe even months as we're facing into whatever we're facing into. And I sent out an email yesterday to our mailing list at theirishpaganschool.com, and definitely go and join the mailing list if you want to be part of that community. And I also put it on a post up on Facebook on the Irish Pagan School Facebook page. So definitely go over and check that out if you want to read it. Basically what it says is, like, how can we help you? Because we are, first and foremost, we are a community. We are a tua in our tradition, a tribe. Myself and my partner John on Scaly Biog we are priests of the old gods and the old ways, and part of the old ways in Ireland is taking care of tua, taking care of clan, which is family, but absolutely that extends to the wider communities. You are our people, whether you're part of my YouTube community or part of our Irish Pagan School community or part of our Facebook groups. We run multiple Facebook groups, so definitely there's a lot of ways to connect into that community, and I know that a lot of you already are. And we've always said at the heart of our business, we are a community service business. We want to take care of our people, and that comes, for us, it comes before anything else. And one of the ways that we feel that we can help is to maybe play to our strengths over the coming, as I said, weeks, months, however long this takes to settle down. And I was going to say get back to normal, but maybe we're going to be in a situation of creating a new normal, because there's going to be a lot of lessons learned. I think that there already have been. There's been a lot of eyes opened as to the actual state of our societies, both, nationally and internationally. That's been very difficult for a lot of people to process, and that's okay. We have a little bit of time to process this. And if you are on lockdown currently, if you are self-isolating, if you're practicing social distancing just as a precautionary measure and a community service measure, which we've been doing for the last 2 weeks, it's all about flattening the curve, and one of the things I'm not quite sure that a lot of people are getting yet is just the maths of the situation. People are still kind of trying to protect themselves in bubbles of it's only a flu, or I'll be okay, it's not affecting my age group, I don't have any underlying conditions. And what they're not realizing is that that the top medical advice from all over the world, and the science definitely backs this up, is to basically behave as if you have this. 80% of us are going to get infected. Yes, the vast majority of those cases will be mild, but before we even hit symptoms, that is a nut stuck in my throat, not a COVID cough. Just FYI. Of course, I'm coughing on my first COVID-19 coronavirus video. So, yeah, a lot of people are shedding the virus, and you have to presume that you have it. You have to presume that going to see your elderly relatives, you're going to give it to them. Going to see your friends that have underlying conditions or whose children have underlying conditions, you're going to pass that on, or you potentially can pass that on. Going to the fucking pub, like, this is not in any way to guilt or shame people who still have to go out to work, who still have to do the things that they had to do before all of this, who don't have the privilege to be able to work from home, who don't have the privilege to be able to take time off and self-isolate and do all those things. This is not in any way a judgment or a recrimination on you, okay? And But the flip side of that is that there are a lot of people who do have that privilege and who do have the comfort and the luxury to be able to choose to panic buy all the stocks in the shops, to take that time off school or work and decide that they're going to have corona parties because that's smart, which is happening in Waterford currently, apparently. Just stop being fucking selfish. Presume that you have this and understand that the maths in your country, understand what the maths in your country is going to look like. I've been talking for a long time about flattening the curve, and people are not getting it. A lot of people are not getting it. And what it really comes down to is looking at, in Ireland, for example, the figure I saw yesterday is that certainly before any of this started, we had 277 intensive care unit beds. 277. Our healthcare system has been stretched. I keep touching my face. I'm really bad at that, but we're in the house. I'm not going out anywhere. I don't actually touch it while I'm out. I've been wearing gloves when I go out so that it actually stops me. It's a physical barrier to kind of help remind me. So 277 ICU beds. And at the most conservative estimate I've seen for how many people will get chronically ill and need intensive care is 60,000. So the idea of flattening the curve is to try and space those 60,000 out over time. Now, I think that the government will have to bring in extra emergency ICU supplies, all the rest of it. But what we're seeing in other countries is that the staff are not available. The supplies, the medical equipment is not available because, of course, this is happening all over the world. So supply chains for medical equipment are definitely being affected. And staff are getting sick. Medical staff have been on the front line of this for weeks now, and they're sick, and that's a huge problem and a huge issue. So the more that each and every single one of us can do to not contribute to that initial surge, that initial wave, if we can just flatten that and even it out as much as possible for as long as possible, the less people are going to die. It literally saves lives, because what's happening again in other countries is that, I think I was covering the mic there, probably shouldn't have been doing that, apologies. What's happening in other countries is that doctors and medical personnel are having to make choices for who to treat, who to give equipment to, who to give beds to, who to let die. And that is horrific and traumatic, and that is a direct consequence of people going around for the previous weeks in those countries not acting as if they had the virus, and passing it on to all those elderly people, all those sick people, all those people who are now in situations where they're not able to get the support that they need. This is not a flu. This is not whatever your unreliable news sources are telling you it is. Okay, this is serious. And so to bring it back around, that's our situation here in Ireland. I'm not going to start giving out daily numbers. I will put a link below so that you can check to the reliable resources. The journal.ie in Ireland is the media source that I'm seeing the best reporting out of, the most clear, the most accurate numbers, the clearest data, the least sensationalist reporting that I'm seeing. And, you know, bonus points, I haven't seen them use a picture of an Asian person when they're talking about, you know, an Irish or Italian situation, which a lot of the other media outlets are doing. And I am specifically not clicking on The Independent, or the Times haven't been so bad. Breaking news stopped a little bit, and they dip in and out of it. Breaking news got absolutely slammed for doing it on their social media channels, and it seemed to have an effect. Yes, I did start that campaign against them. But I don't think I was the only one. I definitely wasn't the only one commenting. So thank you to everybody who stepped in for that. The Independent is another one who is absolutely fucking terrible for it. So, and don't trust those fuckers anyway. So, the Journal seems to be the way to go for news reporting in Ireland currently. So, I'll put both of those links below the video when I get to my computer later on. And not all of my vlogs will be from bed. A lot of them will be from the office where I'm still working away. The downside to having the privilege to be able to work from home is that, you know, we can still work from home. We're not on a break. We're not taking, you know, unless we get sick. Obviously, it's business as usual here, because it's not having an impact and it's not affecting anybody else for us to do that, except hopefully in positive ways, positive knock-on effects. Because, you know, I'd love to see people using their time. Now, obviously this sounds very self-interested, but personally, what I would like to do with that time is self-development and learning and all those things. So if we can help people who want to do that, who want to invest in it, like I said, we're going to be upping our free content, so make sure you're subscribed, you hit the bell for notifications, all that good stuff, okay? And forgive the grotty bed hair, I'm totally getting up. I'm working till midnight tonight. We have I have a Q&A with my Mórrígan practice people, my new round of students, how to build a practice with the Mórrígan course at the Irish Pagan School. And so we have our live Q&A this evening, and I also have a talk with Morgan, a co-teaching panel, discussion panel, teaching panel with Morgan Daimler, and we will be talking about the reality of St. Patrick. So a little timely one there. So if you want to join us live for either of those, if you catch this today, Sunday, the 15th of March, then absolutely join us live. But they're available on the irishpaganschool.com, so you can pick them up afterwards either. Okay, but we'd love to see you in, and we're going to be doing more live online stuff. Definitely make sure you're on the mailing list, because one of the suggestions we got from our email that we sent out yesterday was to do a kind of a social session or a party. And we already do our sitting room sessions, as we call them, kind of randomly. So I think having one of those next Sunday, so that would be Sunday I don't know what date, Sunday the 15th, 7 days from now. But make sure you're on the mailing list for all that kind of stuff upcoming, because I really want to step up, like I said, our community service element. And one of the most common responses that we got to the email yesterday was that, you know, we already do so much, and there's a load of stuff that people have to catch up on already from the free resources and the paid resources, and they're in the middle of classes and courses and you know, YouTube playlists and all the rest of it. So that's all great. But yeah, we want to be here, we want to be visible, we want to be present, and we want to be responsive to our community, and make sure that people know that, you know, you're not alone. You're not alone, you're part of a tour, you're part of a tribe, and that's really important to us to communicate to you and to show up for. Okay? So, slán go fóill, and I will see you in the next video.